We had no choice, so we made the failed knee replacement program. Back in October of 2022, I released the knee arthritis recovery program because we had so many people that were watching our videos on YouTube and asking for help specifically with knee arthritis. At that point, I had a program that was just to help people generally with any kind of knee pain problem. But there was a huge amount of people that needed specific help with arthritis. So we made the program, released it, it was a hit, it's doing fantastic. You can learn more about it in the details. But we then had people asking for help because they had already had a knee replacement and it didn't work out for them. And this happens too much, unfortunately. And I have some stats for you. These are from studies. We'll link them in the description as well. But you have a 10 to 34% chance of having unfavorable long-term chronic knee pain after having a knee replacement surgery. That's almost a third. It is about a third, depending on which study you're looking at. That's a big deal. And so if you're thinking of having a knee replacement, you need to know that. I don't know if doctors are telling their patients this, but you need to understand that 10 to 34% chance of having chronic knee pain. And now I can go into the reasons why this happens. I'll tell you in just a second. But here's another stat that's important to tie in with that. The likelihood of you having a second joint replacement after you've had one is 30 to 45%. Now what that means is if you've already had one knee replaced, there's a 30 to 45% chance you're going to get the other knee replaced or one of your hips replaced because of the problems that arise after having one joint replacement. Now let me tell you why these reasons happen real quick. When you have arthritis in your knee, it's usually set up by muscle imbalances, which is not something that people in the healthcare industry really talk about. They're not focused on that. They're focused on treating the problems that they find on an x-ray. Muscle imbalances are not visible on an x-ray. In a muscle imbalance, you have weak glutes up in the hip, and as a result of that, the quads will overcompensate for the weakness and get really strong. The quads are used more because of their attachment to the kneecap here, and then there's a tendon that attaches down into the shin bone. When they're used more, then they start to pull everything and compress everything here in the knee. Because those quad muscles also go over the hip joint, they can compress the ball and socket of the hip joint. So if you have chronic overuse of the muscles here on the front of the thigh because of that weakness in the back of the hip, it's just a matter of time before you get excessive pressures that cause arthritis down here and up here. And having a joint replacement does not fix the muscle imbalance. It might get rid of the arthritis in the joint, but you'll still have the muscle imbalance that can cause problems in other body parts within the knee and within the hip, and it's going to happen on the other side, cause you to walk and move differently. It sets up the rest of your life with some sort of problem because of this muscle imbalance. So fixing the root cause of knee arthritis is what needs to happen so that you can avoid having a knee replacement and avoid a failed knee replacement. Hey, I want to tell you about our knee arthritis recovery program. This program is specifically for people that have knee arthritis, whether you've been formally diagnosed, you've had an x-ray or an MRI and the doctor told you that you have knee arthritis, or you suspect you have it. And it doesn't matter how severe it is, if you've had it just mild, grade 1, some doctors will tell you, or if it's more on the severe end. If you have tried exercises and advice and tips that I've given you through our videos here, then chances are you have benefited from it because this stuff works. Chances are even better that you're going to get tremendous improvements if you join this program. And let me just tell you how it is real quick, how the program's set up. It's a membership program. There's different tiers of this. On the first tier, it's group coaching along with the whole curriculum of 40 plus. I think it's approaching 50 videos now showing you how to do it. So you can just go through the program, watch the videos, and have massive improvements. But you also get access to group coaching where I'm on the call with you, me and my coaches, and you get to ask us questions so that you don't get stuck through this program. And then you also have the option to get our higher tier, which is one-to-one coaching with our recovery coaches, but you still get the group coaching too. And of course, you get the whole curriculum as part of that package. So go check out the link nearby here to learn more about the knee arthritis recovery program. And I hope to see you in the program on our coaching calls. If you want more details on how to begin to fix the muscle imbalance that causes knee arthritis and hip arthritis, hip problems, check out this video right here. I detail everything about what to do so that you can start to fix the problem and fix the root cause of arthritis.